Hello everyone. Today on this lecture we discuss about the referral system. So referral system is an important topic in community health because in the healthcare referral it's not means the transferring of the responsibility or a patient. Here is the linkage and the coordination between the one level of health service to the secondary and the tertiary level of healthcare we will see in this lecture. So the referral system is defined as the transferring of the cases which are beyond the technical competence, and of one infrastructure to the higher level of infrastructure having the top technical competence and resources. So in higher level we see there the resource facilities are there, much more technical supports are there, and also amenities, these are called the amenities, are available in the higher level. So the ultimate aim is transferring the patient from the fewer amenities to the higher amenities. So transferring means the coordination, linking and the transferring the responsibility. So we will see in this diagram that the referral systems is vertical in nature in our referral system. Let's first see what are the three level of care that will be provided. First is the primary level of care, second is the secondary level of care, and the third one is the tertiary level of care. In primary level of care, the first contact, that is called the first contact between the healthcare provider and the community. So the community people, they will first go to the care institution, that is the sub center that will be located in 5,000 population. And it is here which type of services, the minor cases and also those who are common and uncomplicated intervention, does not require much more management, so they can be managed. So under this section, which organizations are, which infrastructure are come, that is the sub center and the PSC. Okay, next go to the secondary. In secondary, that is the preventive health services is provided. That is the preventive health services are provided in the secondary level. Here also diagnostic and a curative and the specialised consultation also be available in the secondary level of health services. And this is called the first referral unit. Who are come under this, which organizations are come in the secondary level? That is the community health center and the sub-district hospitals. Next we go to the tertiary level. So the tertiary level, here the complicated cases managed, those who are requiring high specialist care. So under this section, which organization come? That is the medical college and hospital, super specialty hospital and the regional hospitals. So this is called the tertiary level of care. Let's see how they are coordinating, because in every sector there are they have some limitations. So the primary health having some limitation, in the secondary level there are some limitations, but by this limitation or the patient from the transferring to the secondary and secondary to the tertiary, so there is a coordination between each level. So that's why it is told that it is a coordinating, linking and transferring the responsibility. The ultimate aim is that to provide quality care and not burden the cost burden to be and reduce the cost of the treatment of the patient. Let's see in this diagram. Suppose a patient that will be come to the sub center for a health service and is not being managed by the sub center, then it will be transferred by the trained birth attendant or the health workers to the primary level, primary health center. In the primary center, we all know there is in 20,000 to 30,000 population, there is a primary health center and there is one of the medical officers are there who will provide the care. Suppose the patient is not managed in the primary health center and require more technical support, then the doctor will transfer the patient to the community health center. And you know, community health center that having the bed strength of 30 bedded hospital and 4 medical officers are there, and also the diagnostic facilities are there. So they will be transferred to the community health center. And in suppose in community health center the patient is requiring many more health services, or the patient is not satisfied with the treatment of this community level, then they will be transferred to the sub-district hospital. Sub-district hospitals are also called the Tulloch hospital, and this is This is within the 1 lakh to 5 lakh population. There the bed ranges from 31 to 100 bedded hospital. Will be 100 bedded hospitals are available in the sub-district level. In sub-district level, again the patient is not satisfied, or the medical officer thinks that the patient need more treatment or more facility, then they can transfer the patient to the district level. And in the district level, there are 3 grades are there: grade 1, grade 2, grade 3, that is 100 bedded, 300 bedded and 500 bedded hospitals are available. So now the patient in the district level. In the district level, suppose after getting treatment, the problem is not solved by the medical officers, or you say the patient is not again satisfied with this treatment, then the patient will be doctor will be refer the patient to the medical colleges. And you know, the medical colleges, both the teaching is the teaching institution and also the healthcare providing center. So this here the good quality doctors are there, and they will be ready to provide the health service of this complicated cases. So this and in medical college, you know, there is more than 500 bedded bed strengths are there. So patient is being managed in the medical colleges. Suppose patient is need more treatment or more technical support or any super specialty treatment is required, then the patient will be transferred to the super specialty hospitals, where he will be get the ultimate treatment and a quality treatment. So by this way we are linking. So each and every steps, every infrastructure having such limitations are there. So here we are transferring the patient for a better and the quality treatment. The patient will achieve the quality treatment. So the ultimate aim is to provide a quality treatment with less burden of cost. So that is the main objectives of this primary of this referral systems. So in referral systems, now we understood about the level of care. So now question is coming in our mind that which patient should be transferred. So according to the triage system, the patient is categorized into 3. One is the category 1, second is the category 2 and the category 3. So in category 1, patients are come under this section, that is the fatal patients. So if you providing the treatment, despite treatment there will be no improvement. So that patient is called fatal cases or fatal patients. Second is come the second serious patients. So here immediate treatment can save the life of the patients. So it need immediate transfer or immediate refer. So our prime focus is to this serious patient. Next to the third category, that come general patient, and the general patients, if we delay the patient or the transfer of the patient will be delayed, there will be not life-threatening condition will be arises on this patient. So first our main focus is the serious patient, to find out the serious patient and transfer immediately. That is the main they are the main patient who give more emphasis as compared to the fatal and the general patient. Next, we see the purpose of this referral system. So why the referral system is very important? Because it is providing you the need-based comprehensive healthcare. Because in comprehensive healthcare, both the promotive, preventive and the curative health services were finding, and that to be according to the need of the patients. So that is, it's provide the need-based comprehensive care. Second, it get proper diagnosis and the therapeutic tools. For each section you see the resources is increasing, and also the medical facilities that also be increases, and also the doctors, and we will find the doctors or medical officers that to be in compared to the primary, secondary, tertiary, that also be increases. So the manpower and the resources and the technical support is also providing is many more as compared to the primary and the secondary level. So this to get the proper diagnosis, therapeutic tool, and to seek admission facility and the better management. So without delaying, if you transfer the patient from the primary, secondary and tertiary, so the burden of the patient, the cost burden will be reduced, and also the time will be saved. So that is the actually we want the patient should be get quality care and without any cost burden. So that is the with a minimum cost, not without, but with a minimum cost. So that is for the better management of the patient. And the last one, to prevent the overcrowding in the specialized hospital. You have seen, if you go to the medical colleges, lots of patients are coming for the OPDs, and there is a crowd like situations, overcrowding like situations is arises, and the doctors are in one day they have to check near about 100 and more than 100 patients in the OPDs. So the quality of the care will be reduced. So we have to reduce this overcrowding. So if the patient is being properly managed in the primary and secondary, so there is no need the patient will be come to the medical hospital or the super specialty hospital. So if you properly manage in the primary, secondary, or in the health facility, the patient which is requiring the health services that can be got in the primary and secondary, they not need to go to the medical college or regional or the super specialty hospital, as there will be overcrowding situation is arising in our in day to day in our in nowadays. So this is all about the referral systems. So referring is not meaning we are transferring the patient. Referring means we are coordinating, linking, and transferring the responsibility from the fewer to the higher immunity. That is the main concept of the referral system. Thank you for watching, and please keep on subscribing.